The narrow passage of Proposition 1, Governor Newsom is touting its possible advantages. The governor touring a behavioral health treatment center this morning in Los Angeles. Now, Prop 1 squeaked by with 50.2% of the vote 2 weeks after the election. Governor Newsom says the bond measure will address homelessness and get help to people suffering from mental illness and addiction.
We're here to modernize the Mental Health Services Act. We're here to modernize our thinking. We're here today celebrating this journey and this successful effort to fundamentally reshape and reform the approach we take to address the issue of mental health and substance abuse and disorder and challenges that continue to vex us out on the streets and sidewalks and those that are suffering alone.
County health officials will have until 2026 to adjust their mental health budgets to reflect a shift in priority from state funds from Proposition 1. Among other things, Prop 1 authorizes the state to use bond and tax money to build more housing for people with mental illness and addiction.
KTVU's Ali Rasmus takes a look at what comes next and the challenges ahead to implement the measure.
What will this new housing look like? Exactly where and how quickly will it be built now that Proposition 1 passed? Those are some of the details we just don't know yet, and it will likely take weeks, if not months, for state and local leaders to figure out. Voters approved this measure, which authorizes the state to use about $6.4 billion in bond and tax money to pay for housing for homeless veterans, people with severe mental illness, and people suffering from addiction. But policy experts say there's a lot of variability about what that housing will include.
What we know is the dollar amount, $6.4 billion, and we know that the governor has promised that will make 11,500 beds as a mixture of housing and treatment beds. But bed doesn't mean very much. A bed could be in a large locked hospital, or it could be in a small therapeutic unlocked residential program. So there's a huge amount of unanswered questions about what beds are actually going to turn into.
Some of the money for housing will come from bonds, the rest from state tax revenue. Not a new tax, but tax money that county and city governments have already been getting. Under Prop 1, local governments will be required to use 30% of that state tax revenue from a so-called millionaire's tax for housing programs for the homeless under Prop 1. There are questions and concerns about what local governments will have to cut in order to pay for it.
You've seen counties and their director of health express concern with potentially this measure. We're the social safety net. There may not be enough funding for the counties to provide other services because they may have to support these additional services.
Governor Gavin Newsom alluded to some of those possible challenges in a statement, saying, quote, now counties and local officials must match the ambition of California voters. The historic reform will only succeed if we all kick into action immediately, state government and local leaders together. It's time to get to work, end quote. Proposition 1 barely passed by about 30,000 votes of the more than 7 million cast.
I think that the state has a limited window to show results. What we're seeing from the voting tallies is that a lot of Californians are becoming increasingly skeptical that we can do anything around the crisis of mental health and homelessness. And in order to fight back against that, the state needs to really show that it can use this money effectively.
There's an estimated 181,000 Californians who are homeless, an increase of 40% since 2018. Ali Rasmus, KTVU, Fox 2 News.